Hey everybody, this is Dr. Laney again, board certified pediatrician, mom of 6, including Sarah, and grandmother to 2, but they don't live nearby anymore, so that's sad. So everyone asks me about, well, how's Sarah? How's she doing? What's an update? Because everybody seems to enjoy these videos more than when I do them by myself. So I talked Sarah into joining me again today, and we decided that today's topic would be depression medication or medicines used for depression and anxiety in teens. And I'm relatively comfortable with this topic because, as you know, I do med management for some of my teenage patients who are struggling with anxiety or depression. But obviously, I don't manage Sarah's meds. So would you like to tell us about your journey with medication? And if you guys are new to the channel, Sarah was diagnosed with depression when? 2 years ago?
I went to psychiatrist almost 2 years ago.
Almost 2 years ago.
I've been in therapy longer than that.
Yeah, that's true. We started, as I would recommend, with counseling first. And then once the therapist or counselor feels like the patient would benefit from both counseling and medication, then proceed to medication is how it worked for us and usually with my patients as well. So tell me about your medication journey, Sarah.
So psychiatrist first gave me fluoxetine, which is Prozac, was more commonly used name. And she said there might be side effects, and I was like, okay. And she was like, yeah, this might not be the right one for you. Just let me know. So I took it. I was on it. I think I don't remember what the dosage I started on, but I went on it, and I had bad side effects, and I thought they'd go away after a couple weeks, but it was a month, and it was bad. So I was just like, this isn't working. But the side effects were mostly just suicidal thoughts, which is ironic for an antidepressant.
Right.
But so that actually made me more miserable than I was before, which is scary because you might think, oh, well, what if I get on the wrong one and it works out terribly? Well, I mean, it might happen, but you can always switch to a different one like I did. And my biggest thing would just be tell your psychiatrist or doctor how it's affecting you so they know the whole picture and see what it's doing, you know? Because I thought it was just going to get better, so I downplayed the side effects, and I was like, okay, I can't keep ignoring this, you know? And so then she switched me to Zoloft, which is sertraline, and that one was much better. At first, I had side effects of very vivid nightmares for a little while, but I got used to it, and I don't have them anymore. And I like Zoloft. It does a good job. The difference is I'd say it numbs like my emotions, so I'm not as sad, and also it makes it harder to cry. Because like before I was on any medication, I'd cry like several times a day. And now, even if I'm sad, I don't really cry as easily. It's harder to. I have to really make myself really want to. And even then, sometimes I don't, just because it's kind of numbed me, which is a good thing because that's part of its job. But that's really the only side effect I have from it, besides the nightmares, but those went away after a couple months.
Well, you mentioned that it numbs you for the sadness part. Does it make you have less happies? You seem pretty happy sometimes.
No, it doesn't really numb the happiness. Okay. And the best way I can describe it is I still get sad in my head, but it's not shown in my body, like from crying and stuff, as much. Even if it's in my head, it's not exhibiting itself through tears and whatnot, even if I want to cry.
Now, would you say, did it completely take away your thoughts of self-harm?
No.
But nothing like with the other one that increased them?
Yeah, it didn't increase them at all. It didn't necessarily take them away. I mean, I've just learned to deal with that through therapy mostly, but I feel like what medication does is it kind of distances you from the sad thoughts or whatever, and it lets you take a step back, and they're not so pressing and urgent and on your mind all the time, so it gives you time to think and, you know, work through things, which I think is very helpful.
And at least from a perspective of somebody living in the same house with her, she now can get extremely excited about things like your friend visiting Gabriel, or trips, or, you know, like our summer vacation to the beach or whatever, super excited about that. And there was a while when she was very sad early on that, do you remember this? Nothing made you happy. Yeah. Not Christmas, not presents, not parties, not food, nothing. And now she gets really excited about fun things, really has some zest back in life and some joy back in life. And that's been very encouraging to see. So how long would you anticipate you would stay on meds? Forever, or for at least?
At this point, I want to say indefinitely, just because I've reached a good solid point in my life with the medication and the therapy and everything, and I feel like I'm at a good place. And I don't want to do anything that would make all that work go backwards or like go away, you know. So for right now, I want to stay on what I'm at, At some point, I might want to like lower the dosage or maybe even go off it completely. But for right now, I'm happy and steady, and I want to stay where I'm at.
Good. So a lot of times I'll run into families and understand as a pediatrician, I'm already slightly nervous about this category of meds because it's relatively, not very, but relatively new that primary care is managing meds in teens. And so I'll have some families that say, oh, I would never let my child be on medications. So what would you say to parents who would say, I wouldn't allow my child to be on medicine?
It could literally save their life.
Yeah, that's kind of what I was thinking too. Because if they need this help, both counseling and medication.
If I wasn't stopped, I probably would have attempted something at some point.
And
even after medication, I wanted to at one point. I didn't, but I still wanted to. So it's not like an end all be all, but it helps.
Now, did it make you feel better immediately once you took the first pill the next day?
Not really, no, it was a gradual.
Right, and that's what we try to anticipate for patients too, is because sometimes teens will get very discouraged with acne medicine or whatever it is, or pills to control their bad periods, and if after the first dose they're not better, they get frustrated. And with mental health meds, they're not a precise, immediate tomorrow it helps. It's a long-term.
Because it's all about hormones and chemical imbalances in your brain. It takes time to fix those. It's not just like bam.
Immediate, right. So I'm glad that she understood that. Her expectations were realistic. So I think some teens get discouraged thinking, I feel so horrible, I want to end my life, and you gave me medicine, and I still feel just as bad. So that's very discouraging. And it's important that they and the parents understand it's not an immediate fix. And it should be done in correlation with counseling. Because as Sarah said, some of the ways she learned to think about things differently, that was just through therapy. The medication can't teach you how to think about things differently than you were already.
Therapy helps with coping mechanisms, when you feel like this, do this, etc. And even though medicine can help you from feeling those things as often, it doesn't necessarily mean you'll never feel those things. So you still need to be able to deal with them and handle them, which therapy helps with.
So do you feel like at this point this is about as you're the best? It feels like living with you that this is the best you've been since we started this journey.
Oh, for sure.
Good.
Yeah.
Good. Excellent. It's just fun to live with her, to get to see her really excited and happy about things. And for a while we weren't seeing that. So it's good to have you back. You're a cute little excited self about things. I love it. So as always, please let us know if you have any additional questions. I hope this was helpful for parents who are very nervous about medication. Nobody's going to force it on you. Nobody's going to make you do this. I hope you know your primary care physician or your psychiatrist, we really just want your child to feel better and to be able to find the joy and the happiness in life again when they're struggling with some of these mental health diagnoses.
And if you're like a kid or teenager or someone that's thinking about going on medicine, it can be scary and there are side effects. But overall, it's probably going to be a good choice, and it might be scary and hard at first, but it should get better. And of course, keep everyone notified as to what symptoms you're having and if things get worse or better, and keep everyone informed so they can better know how to take care of you.
Absolutely. And there is that warning when you very first start meds of this category that it could increase your suicidality or thoughts of self-harm. And so it's extremely important that the parents watch very closely if their child has started a medication or had a medication doses change or switched categories, things like that. Very important. Thank you so much. You're the best. I hope you guys enjoyed that.